Good morning everyone! My name is Marcie Violet P. Lozano from BSN2, and for this video, I will be demonstrating infant basic life support. So before we proceed to the actual return demonstration, I would like to define first what is the meaning of BLS. BLS, or Basic Life Support, generally refers to the type of care that the first responders, healthcare providers, and public safety professionals provide to anyone who is experiencing cardiac arrest, respiratory distress, or an obstructed airway. It requires knowledge and skills in cardiopulmonary resuscitation, or CPR, using automated external defibrillators, or AED, and relieving airway obstructions in patients of every age. So for the preparation, assemble equipments and supplies. So what we have here is we have the face mask, face shield, clean gloves, and the improvised AED. So for the procedure, check the scene for safety. If you are in a hospital setting, you are safe. But if you are outside the hospital, check the environment. If you are crowded with people, do not allow them to go near the patient. Next procedure is activate EMS. If you cannot activate EMS, yell for help. Help! Help! You in a black shirt! I need your help! If you are by yourself, perform 5 cycles of CPR and remove the infant's clothes. Next procedure is check for responsiveness. We're going to tap the fetal part. Hey, are you okay? Check breathing and pulse. Assess if they are breathing by putting our ears in their mouth or by watching their chest. Next is we're going to palpate the brachial pulse for no more than 10 seconds. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Brachial pulse is the most palpable part, especially in the infants. Because if you try on the real pulse, you cannot feel anything. And if you are going to palpate in the carotid area, your fingers are too big. If there is no pulse and there is no breathing, start compressions. But make sure before you start compressions, do not press at the end of the sternum because it can cause injury. One-man rescuer. So for the depth, at least 1/3 of the chest, about 4 cm. The rate is 100 to 120 per minute. So for the position, just below the nipple line, on the lower half of the breastbone, 2 fingers on the chest just below the nipple line. So for the ratio of the one-man rescuer, it is 30/2. If there is no pulse and there is no breathing, we're going to begin the CPR. 30 chest compressions followed by 2 breaths. But since we do not have the bag valve mask, we're just going to chest compressions followed by chest compressions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Two-man rescuer. For the depth, it is at least 1/3 of chest, about 4 cm. And for the rate, it is still 100 to 120 per minute. So for the position, just below the nipple line, on the lower half of the breastbone, 2 hands encircling the baby's chest at the center of the chest, just below the nipple line. The ratio for the two-man rescuer is 15/2. I'm going to perform now the chest compressions 15/2. Since we do not have the bag valve mask, we're just going to continue chest compressions. Okay, we're going to put my 2 hands encircling the baby's chest at the center of the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And if we have the bag valve mask, The second rescuer will going to give 2 breaths. But since we do not have the bag valve mask, we'll just continue chest compressions. If there is pulse but there's no breathing, we're going to give rescue breaths. Give effective rescue breaths by allowing the chest to rise. But since we do not have the bag valve mask, there's no need to perform rescue breaths. This is to protect the baby from having infection in this time of pandemic. We are now going to perform AED or the automated external defibrillator. The first thing you will do is turn on the AED. Next is we're now going to attach the pads at the center of the baby's chest and back. So in the pads, there is an indication where you will going to attach it. At the center of the baby's chest. The next pad is at the center of the baby's back. Just going to turn the baby carefully. After we attach the pads, do not touch the patient and let the AED analyze the patient's rhythm.
Do not touch patient. Analyzing heart rhythm. Please wait. Do not touch patient. Analyzing heart rhythm. Please wait. Preparing shock. Move away from the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient.
After the shock has been delivered, we're now going to perform 5 cycles of CPR. For the one-man rescuer, we're going to put 2 fingers at the center of the chest, just below the nipple line. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After doing 5 cycles of CPR, we're now going to check the breathing and the pulse. We're going to palpate the brachial pulse. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. If you are performing AED with a 2-man rescuer, make sure that you will switch to another rescuer to avoid exhaustion. Next is continue CPR until the emergency team arrives. Remember, after 5 cycles of CPR, check signs for life. If there is no signs, repeat the 5 cycles of CPR and check for the signs of life again. Continue this process over and over again until the infant wakes up and until the emergency team arrives. If there is no pulse and there is no breathing, we're going to observe and monitor the infant. Total chest compression and time percentage achieved. Our recommended is 60% and our goal is 80% and it is achieved. After that, we're going to transfer the infant to the hospital. And the last thing that we're going to do is document everything that you've done.